going back to around the summer of 2019, I started having some really bad back problems. It's something that I've had my whole life because of a diving accident when I was a child. But as I got older, it started to get worse and worse. And I spent a year in physical therapy, had 3 epidurals, and finally came to the conclusion that I needed to have spinal surgery, which is never a pleasant experience, I found out. However, I had what I considered at the time to be a good surgeon. And so under his guidance, I went for surgery on March 28th of this year. It was a 10-hour procedure. My lower back, my tailbone were crushed basically from my accident. So my tailbone and the next vertebrae up, which was, I think, L5. So they had to go in from my stomach and from my back, and they did that. A couple of days later, I got out of the hospital. 4 days, that was a Monday. I got out of the hospital on a Thursday, and I was walking with a walker. So I came home on Thursday, and I was sore, and I had some, residual in my legs. And then Tuesday morning, following a week and 1 day after, I woke up Tuesday morning and was completely paralyzed. And when I say completely paralyzed, I mean, I couldn't stand, I couldn't roll over in bed, I couldn't do anything, I couldn't hold my phone. Of course, that's pretty unsettling. So we called 911, and they came and brought me to a hospital, and it wasn't the hospital where I had the surgery. And after 24 hours, they sent me by ambulance back to the hospital where I had the surgery, which is in West Palm Beach here in Florida. Took them about 3 or 4 days to diagnose what was going on. The numbness and the tingling that I had in my hands and my feet had spread throughout my body, and I couldn't move at all. And with back surgery, you can have problems with your lower extremities, but it was also in my hands. And so that meant that whatever was going on was a systemic thing. Turns out after 4 or 5 days in a spinal tap, I had Guillain Barre syndrome, which is an autoimmune disease which attacks the nerves in your body. And the nerves can't communicate with your muscles anymore. So there's a danger that you could stop breathing because your diaphragm is what causes your breathing. So I ended up in ICU for 4 or 5 days with a watch over so that I almost got intubated is what I found out. I don't remember a lot of this because I was pretty heavily medicated. My wife tells me. Anyway, after that, I had an intravenous immunoglobulin treatment, which is the treatment of choice for what I have, where there is no real cure. Some people never get better from this, and some people takes them a long time to get better. But I went into an inpatient rehab for 3.5 weeks. And at that time, the GBS, Guillain Barre syndrome, was still onsetting. So it wasn't at a point where I could actually get better. I came out of there in the early part of May. May 10th was the date I got out, and I came home, but I still couldn't do anything. I could barely move my legs. My muscles in the space of 6 weeks had completely atrophied. And I was in pretty rough shape. Can't go to the bathroom, can't take a shower, can't brush your teeth, can't feed yourself, can't bathe. Really couldn't do anything. And then I started in-home physical therapy. And shortly after that, that was in May, my sister, through Monica, introduced me to the patches in July. And I was using the X39 pretty much exclusively at that point. I also had a problem with my left ankle. The Guillain Barre was not symmetrical in my body. It affected my left half of my body worse than my right half. And I'm left-handed, so it was really a challenge for me because I'm still having trouble dropping things. I have no tactile sense in my fingers right now. But anyway, I started with the X39 patch, and the physical therapists that were working with me couldn't believe the responses that I was having from the treatments that I was getting, because there were muscles that were not activating that all of a sudden started activating. And that was the first time. And she was my first therapist who said, I can't believe how quickly you're getting recovered from this. This was in August. So my goal was to get to the end of August and be able to walk with a walker. I stood up for the first time with a lot of help and a lot of fear on June 2nd. which happened to be my mother's birthday, may she rest in peace. But that was the first day I actually stood up from March 28th or from April 4th when it started to, I actually could stand for 2 minutes. That was it. And then I had to go back to the wheelchair. Anyway, so fast forward to July, I start with the patches, and I was getting ready to go on a trip in September. I wanted to be in a walker. My therapist worked with me until that time, and in the middle of August, I switched. My in-home physical therapy ended, so I'd had, I don't know, 12 weeks of physical therapy, but my recovery was actually pretty miraculous because 4 weeks in, and I was already 4 months in, rather, I was already walking. I'll just emphasis on that because I'm part of an international group of people with Guillain Barre syndrome. It's kind of rare. And so there's people all over the country, all over the world that are in this group. There's like 1,500 of us. And there are some people, when I report my recovery, they can't believe that I'm actually walking and driving, and I'm what, 6 months post onset right now. Anyway, so I came back from my trip in mid-September with a walker. I had a problem with my ankle. I put a boot on for 2 weeks, and after that, I didn't need the walker anymore.
So you got on the patches in July, and then how long was it before you started walking then? Was it in August?
I started walking in the middle of August with a walker, and when I came back from my trip in September, I went with my friends to Tennessee. They were pushing me around in my wheelchair, and I still had the walker, and my balance was really off. When I came back, I took a 2-week break with a boot on my ankle, and then after that, I was walking, and I was in aquatherapy, and now I'm in the gym working. It's helped me a lot with my nerve connection because I still have a lot of neuropathy in my feet and my hands. Whoever mentioned the prostate thing, I got that. It's doing that for me.
Wow.
And that I can tell you without a doubt. It's like like I'm 45 again, not 69,
Wow.
So that's pretty good. I'm
Amazing.
happy with that. I'm happy with that. It's hard with Guillain Barre because I don't have a reference point. We talked about this, Charity. I don't really have a reference point other than other people who are that have the same thing that I have and haven't walked in 2 years or haven't been able to unclench their fists. And I'm 7 months or 6 months in, and I'm driving, I'm walking. I mean, I got some issues, balance issues. I have vertigo a little bit. My hands, my feet, tingling all the time. But if that's
the body is definitely healing, and we're so thankful. Yeah.
Pretty good. Yeah. Very happy.